Assalamualaikum and good morning to everyone. So my name is Mikhaeil, while the person next to me is Miss NAFISA, and today our program is Malaysia Hari Ini.
Thank you, Adam. So glad to be with you here today. So Adam, what is our main topic for today?
Today we are divided into the importance and complex world of health policy. We will be discussing the information of Malaysia health policy in the past 5 years.
Oh, as I can see, over the past few years, there have been some changes. Some significant changes in the past formation of health policy that aim in the better healthcare services for better healthcare delivery.
Yes, it is true. It's an exciting and evolving field, and we will explore some of the major advancements and challenges in the health policy reformation. So let's dive in and discuss. So before that, let's watch this video first. Okay. Assalamualaikum and good morning to everyone. Today I'm your moderator. My name is Nyak bin ZURIMIN. So today we have two beautiful guests to discuss about the medical health program. This is Dr. NAFISA and this is Dr. NADZIRAH, as you can see that. So today I will be briefly about the introduction of medical health program. So what is medical health program? Medical health program is something that prioritizing strategies and implementation plans. The medical program was able to identify significant issues and challenges ahead of times. This listing helped to focus our effort over the next 5 years. In the next 5 years, a number of major challenges are anticipated, such as changing social demographic, an increase in the incidence and prevalence of non-communicable illness, and the emergence and reappearance of infectious disease. So as you can see, medical program is so important to planning our next 5 years for the implementation, what we have challenge in the past 5 years and what's the issue and what's the changes, as you can see that. So for the preparation of 5 years, before this we have certain issue. The policy issue that we can say that is the unmet human resources needs with increasing workload and company, and the second issue is about all health facilities and equipment also, and the lastly issue is about disaster and crisis management, as you can see that. So what is the medical program strategies? As you can see that the medical program strategies is strengthen healthcare service delivery in hospitals. We have 7 of strategy lah. That's one of the 7 strategies, as you can see that. Secondly, optimize resources management, including facility, equipment and financing. Also the standard governance and stewardship of healthcare system. And fourthly, the standard safety and quality in delivery of healthcare system. And the fifthly is enhance capacity and capability of human resource of health. And the sixth was leverage the use of information technology to improve effectiveness. And the lastly is about promote safe and quality practices of traditional and complementary medicine. So as we can see that this is a 7 strategy of the medical program health. So we can see that we can go through for the next guest, that is Dr. NADZIRAH. Can you explain what is the objective of the medical health program?
So the government highlighted that this program was developed to set a clear and actionable pathway to progress to catalyzing new and sustainable investment in the health and care workforce. It is set to continue to play its role in inter-sectoral collaboration, international commitment, development of the health industry and research.
Okay, so for the NADZIRAH, I have some question for the objective that you just said. Is it the same for the objective during COVID-19 and the difference of the objective of medical health program for right now? Can you please describe it?
Okay, so when the pandemic of COVID-19 occurred at the time of building this program, it is important to always keep putting continuous effort to provide a better healthcare system to be effectively responsive to any crisis and disaster. So this has turned the government's objective to make sure that every Malaysian citizens get an equitable access to the healthcare. This includes to those who live in a rural area and that hardly get enough use of this public facility. This plan also requires continuous monitoring, prompt and accurate measure of population access to healthcare.
Okay, for Dr. Nazirah, I have a few questions about the changes that happened during the past years and for now for the implementation of the policy of medical health program. As you can see that, can you briefly explain a little bit about the changes that happened for the implementation of policies?
Okay. So there are a lot of changes that are being implemented during the reformation. One of them was the expansion and development of hospital services. In the previous plan strategic KKM 2016 to 2020, the government has stated that poor handling of emergency cases on phase before the patient gets to the hospital was the main factor that contributes to increase death rate avoidable. So, as pre-hospital care and ambulance service is one of the most important consideration in the medical program, the government urged in expanding and developing the hospital services by aiming for better ambulance response time, whereby target ambulance response time for a prior one case is less than 15 minutes for at least 50% of the cases. The changes that are being implemented during the reformation was the development of medical profession that is being emphasized in ensuring the success of this medical program. The government has received a lot of positive feedbacks and responses from the public as we help services sector serve a good quality services with an affordable charge. However, the main issue that the government has been concerned about is the problem of lack of manpower, which has led to long waiting time for getting health services. Over the recent years, Malaysia has faced persistent challenges related to the scarcity of clinical specialists within the public sector. The government has also identified that the availability of specialist training position within local university is quite limited, and the attrition rate among specialists and healthcare professionals who undergo training in at the Ministry of Health is notably high. The existing incentive designed to retain these specialist experts have yielded unsatisfactory outcomes, as a significant number of them have opted not to continue their service within the public sector. This has resulted in disparity in the quality of healthcare services, with variations in standard for medical practices, healthcare quality, data collection, and the sharing of healthcare information between the public and private sectors. So this time, the government came up with various kinds of engaging initiatives in developing the medical provision. This includes the specialty and subspecialty training for medical doctors, expansion of the full paying patient scheme, flexi working hours, and not to forget a new higher grade UD 56 that offers better salary. As of 2019, it seems to give good impacts to the government, as it resulted in a gradual increment in medical professions. The Ministry of Health claimed that allied health professionals with over 28 categories of profession in MOH had a gradual increase over the years to reach about 24,000 in 2019.
Oh, I see that. Is there any changes that you want to add more, Dr. Nazirah?
There are also changes that the government implemented, which are making patient safety as a priority. So this focus on making sure that when people receive medical care or treatment, they are protected from harm and receive the best possible care.
Oh, I can see that, yes.
So the government implemented a routine gatherings and training session were held for Ministry of Health employees to enhance their understanding and proficiency in areas related to serving as expert witnesses, composing inquiry reports, and managing ex gratia cases.
So as we can see that for the regarding of the policy issue of the unmanaged resource, old facility hospital, and the disaster and crisis management, so all these policy issue may have some challenges as we can face it. So what is the challenges of the policy issue problem, as you can see that? So for that, Dr. NAFISA, you will be briefly about the challenges. So I will pass it for you.
Okay,
Thank you, Mr. Adam. So, related to the policy is that for the first policy issue, which is the unmet human resource because of workload,
Yes.
okay, in order to overcome the issue, there will be some challenges, which is the shortage of human resource. So, the shortage of medical staff in Malaysia's healthcare system is due to the lack of position of medical talents and the reduction of supporting workers such as doctors and nurses. So, this has also negatively impacted the efficiency of healthcare delivery, especially in hospitals. So, there aren't enough healthcare professionals to meet the demand of the patients, especially in the trauma wards.
Yes.
So, this led to longer wait times, as been explained by Dr. NADZIRAH regarding the patient wait time at the hospital or clinics. So, that's actually increased the workload for existing healthcare service. So that's, for example, in hospital, there's only 10 nurses, but in order to meet the demand of too many patients, the 10 nurses have an overload duty in order to give a better healthcare delivery for the patients. So for the next challenges is the ineffectiveness of healthcare facilities.
Yes, correctly.
Regarding the policy issue with the all healthcare facilities and equipment. So,
yes, correctly.
referring to the year 2018, which is the previous policy, Malaysian Health at a Glance, published by the Malaysian Healthcare Performance Unit. Okay. In the policy, it states that the economy is a very important factor in order to make sure that the healthcare facilities is at its best. So, the hospital must have enough fund in order to purchase new hospital facilities and equipment, so that all patients are receiving a better equipment, a better technology in treat themselves. So, however, but due to the low economy in Malaysia, the healthcare cannot provide a better facilities and technologies for the patients. Yes. So the public healthcare facilities and service in rural areas are also still inadequate. As we all know, in rural areas, there's some people who cannot receive a better treatment because of lack of technology, lack of facilities, and of course lack of clinics. In Malaysia, we call it clinic kesihatan.
Yes,
So, lack of connectivity and low frequency of mobile healthcare service, as well as inadequate facility, hamper efforts to deliver quality services to the population in rural areas. So the third challenges is the emergence of COVID-19, which is to introduce the disaster and crisis management. So, during the implementation of the medical program, the policy is developed during the pandemic, right?
Yes,
so, the sudden emergence of COVID-19 have give a big impact in Malaysia, especially in healthcare facilities, since the virus are infectious and easy to transmit to other people. So Malaysia is facing a double disease burden challenge where communicable disease coexist. Okay, there's some disease that already exist, but however, plus the COVID-19 comes suddenly, give a very heavy burden to the healthcare facilities. So the pandemic was still ongoing even after the implementation of the movement control order. There are certain hospitals are prioritized for the COVID-19 patients because COVID-19 patients must give full care. They cannot simply treat by other people or mix with other people because the COVID-19 is a very infectious disease.
I understand for the COVID-19.
So overall, in order to achieve the medical program, the medical program was created by the healthcare government is in order to overcome the issue. However, there are some challenges in order to overcome the issue. So that's all from me.
I see that for the challenges that you just informed to us is very, very complete and compact, let's say, and we know what the challenges that they have issue that they are facing from the problems, as you can say for the policy medical program. So now can I ask something for how the government managed to come the solution for the challenges and the issue problems? Can you, Dr. Nafisa, say something for the resolution?
Yes, so in order to overcome the challenges, which is the shortage of human research, shortage of medical talent, a challenge is to enhance capacity and capability of human resource for health. So, in order to overcome the lack of doctors and nurses in certain areas, the Ministry of Health in Malaysia increased the number of medical schools and training programs and also provide incentive for doctors and nurses that are work in rural areas. So this effort is to aim to ensure that healthcare services are accessible to all citizens in Malaysia, even in rural areas. So resources such as staffing amongst others, with effective management being critical to ensure you are able to provide the best possible care. So for example, having a plan to cover staff, especially on emergencies. Let's say the staff that are on duty at the rural area, but they have been an emergencies problem. So there are also another staff to replace them, to cover their duty in order to give treatment to other people.
I see.
So another resolution is to strengthen healthcare services. So healthcare services are provided through facilities that include specialists and non-specialists and clinics. Okay, another initiative in the delivery of healthcare is through the home-based care.
Home-based care.
By delivering the healthcare service, let's say there's some patient who cannot go to the hospital, so the hospital can provide a delivery healthcare by sending some medical staff to their home. So furthermore, attaining excellence in quality and safety within our healthcare service require a multi-pronged approach to improve its structure and processes to achieve a better patient outcome. So best facilities, best patient outcomes.
Best facility, best patient outcome. Yes.
So the third resolution is the management for infectious disease. As I explained just now, the emergence of COVID-19. Okay, that's a very communicable disease where it can be transmitted to other people if you are having COVID-19.
Yes.
So the medical program has played a pivotal role to complement the role of public health program in controlling the pandemic. Okay, during the pandemic, we all know that it's been a chaos. So Malaysia Healthcare have been worked overtime in order to control the pandemic, in order to control the infections of the COVID-19. So since they have already faced the emergence of COVID-19, the national capacity already enhanced disease surveillance, which they will monitor and control the infectious disease. If there is, for example, if there is a patient who having COVID-19, the national policy will control and put a surveillance on the patients in order to avoid any transmissions to other people who didn't get infected.
I see, understand.
So they shall include the preparedness of hospital services in facing the emergence and re-emergence of infectious disease in the Malaysian population. So in conclusion, the resolution from this disaster management, the health policy are able to prepare to face any problems in the future in case there is a new infectious disease. Yes, that's all.
I can see that your solution is very complete, and the example you given for the how to facing the problems that will come for the next few years, or by referring the past years issue and challenges. So it's very good. So the government already well prepared, as you can see that for the medical program had for these times. So can you so we want to know what is for the summarize for the conclusion of our today medical health program. So can I say for Dr. Nafisa for give some conclusion or summarize for our program today?
Sure, Mr. Adam. Yes. So throughout our discussion, we are talking about the reformation of the health policy. So the reformation is very important because it is crucial for the public's benefit and addressing public issue. It ensures equitable access to quality health care, improve healthcare delivery systems, promote preventive measures, and enhance public health education. Okay. So by prioritizing public interest in health policy, we can overcome various challenges and create a healthy society for everyone. Okay, in conclusion, the reformation will able the government to identify the future issues by analyze the past issues. So from the reformations, we can overcome the past issues by develop a new solution in order to overcome the future issues. So furthermore, through policy reformation and action, necessary changes can be identified to improve the policy's effectiveness. However, in order to ensure the success of the policies, the public involvement and engagement are vital in achieving the desired outcomes of the policy for the benefit of the entire community.
So thank you, Dr. Nafisa, for your very impactful and conclude of your summarizing conclusion about our today medical health program policies. So as we can see that how important of our medical health program for our nation to be a better Malaysia. So it's very the government have done very preparation for the next future outcome by referring the past years of the problems, issue and challenges, so they have come a very good solution for upcoming years if anything happen in Malaysia of income of health. So government is very well prepared, as you can see that. So today I just want to say thank you for our beautiful guests that come, Dr. NAZIRAH and Dr. NAFISA, for your own time to make based on your schedule that very busy, to make your free time to come for our today program for Malaysia hari ini, and for introducing about little bit briefly of the medical health program. So that's all for us, and very thank you for our everyone that has seen us. And lastly, I want to pass to my friends, and that is Miss Mas over there, because we have doing something interview session for out there for our community about their own opinion and their own opinion for the medical health program, for the health issue, for their own opinion. So we made some interview session out there for our own community. So Miss Mas, you can start for the interview session and share with us. Okay, you guys can watch for the interview session. Alright, thank you. Bye.
Thank you, Mr. Adam. So today, here I am at the UiTM Medical Center to interview a few students regarding their opinion about the healthcare system in Malaysia.
Overall, I'm very satisfied with the government's hospital facilities because we did not have to pay a huge amount of money to get treatment.
Hi, can I ask you a question? What are your response to our responsiveness of emergency medical service?
Emergency medical service, I think, to me in Malaysia has been quite slow. It takes around 30 to 40 minutes, and I think that can be considered as a failure because the waiting time of emergency responsive could be the line between life and death for people who need treatment. So yeah, that was my opinion.
I think public healthcare in Malaysia is quite basis in rural area, and the best public and private facilities are always located in the larger cities.